Okay, welcome to question number two, and this is something important here. As you saw that first line blind spot, when a question is talking about blind spot, you have to think about pituitary gland always or in most of cases. Okay, so the two important concept are is there. It's about diabetes insipidus and SIADH. Okay, so diabetes insipidus is all about low antidiuretic hormone, means there is nothing to cause antidiuresis, means there is nothing to cause concentrated urine, means there is continuously diuresis, means more urine to pass. Okay, as patient is passing more urine, imagine you are passing more urine, means the iron concentration will be low, means the urine osmolality will be low and the blood osmolality will be high. Okay, clear concept. The diabetes insipidus is divided into two parts: nephrogenic diabetes insipidus and pituitary, means central diabetes insipidus. In pituitary diabetes insipidus there is no hormone. Okay, hormone is not synthesized, but in nephrogenic diabetes insipidus the effect of hormone is not present. Okay, on kidney the hormone is present but there is no effect. Okay, the important cause for the nephrogenic diabetes insipidus, you have to remember lithium ion and sarcoidosis. Okay, it means lithium toxicity. Okay, in nephrogenic diabetes insipidus, when you measure the ADH, it will be more than 1 picogram per ml. Okay, next, if we go to the SIADH part, this is also called G-volumic hyponatremia, and it is mostly found in the brain injuries. Okay, you will see the in brain injuries, the question will mention that a patient is got accident, met with an accident like this. Okay, in this SIADH means syndrome of inappropriate antidiuretic hormone. The terminology is itself explaining this, that antidiuretic hormone means ADH is more, means antidiuretic. Antidiuretic means someone is decreasing. Antidiuresis means there is something is concentrating. Okay, the concentrated urine is there. Okay, if the urine is concentrated, mean the in blood the water is stored. Okay, urine concentrated mean where is the water going? In the blood, means there will be hyponatremia, but it is not a true hyponatremia, it is a relative hyponatremia because the sodium is as it is. Okay, so if you go, the blood osmolality will be low, serum osmolality will be low as you are getting more water, and the urine osmolality will be high. High means that you are excreting concentrated urine. Okay, I hope this is very clear. Okay, these 2 points are very important. Remember it. Urine osmolality almost more than 100. Okay, so basic part is that the normal osmolality of serum is 280 to 290, and the blood formula, you have to remember this, that 2 into sodium plus BUN 2.8 glucose divided by 18. This is the formula when the answer is in milligram per deciliter. But if someone is asking the answer in millimole per liter, you have to remember that 2.8 and 18 will be not there, and the formula will be simple like that: 2 into sodium plus BUN plus glucose. If they are asking if there are millimole per liter in the answer in the options, okay, the urine osmolality will be around 50 to 800. Okay, so there are two tests that is important. One test is water depreciation test, that is used for uh, remember diabetes insipidus. Okay, and there is test of SIADS that is used for water loading test. You have to remember uh, anyway you like. Okay, there is no trick for my side. uh, this is the important chart from Harrison. You see that urine 24-hour urine volume osmolality unrestricted fluid intake. So after you are not restricting the fluid intake, if you see that volume is more and osmolality is low. Somewhere, as I said, volume is more. More volume means there is diuresis is not happen. Means ADH is low. Okay, low ADH means we are talking about diabetes insipidus. There are, if we measure the plasma AVP, AVP means this is the mean vasopressin. Okay, so if this is more than 1 picogram per ml, it is will be nephrogenic diabetes insipidus because there is hormone is present but not affecting on kidneys. Less than 1 picogram per ml, it means this is the central. For the central, you have to do brain MRI and you will see pituitary bright spot. If pituitary bright is present, means this is the primary polydipsia. If pituitary bright spot is absent, it means that pituitary absent and the pituitary diabetes insipidus is the cause. Okay. Next, let's explain this water deprivation test. Little bit about this. This is important for the exam also. That in the water deprivation test, we are measuring about what? Diabetes insipidus. Okay. So if you think about diabetes insipidus, means more urine. Okay. As you know, there will be more urine. If the urine is more, simply remember that there is no water given for to the patient for 3 hours and evaluate serum osmolality, urine osmolality, body weight. As there is diabetes insipidus, more urine will pass. Okay. If this is top 10, this is not first. Check urine osmolality. Means if urine osmolality is after water depletion is normal, means it's a psychogenic. It means the patient is drinking more and more water. But if urine osmolality is still less than 600 mole per liter after you stop giving water, means what will body do? Body have to stop saving. If you are not giving water for 3 hours, body have to save the water, but still body are not saving water and urine is still hypotonic. Okay, so you have to put a desmopressin, which is a synthetic ADH or vasopressin. It will save the water. Okay, after how? If the concentration increase more than 50%, mean it is the central diabetes insipidus because you are giving desmopressin. Okay, and desmopressin is affecting now the kidney, means kidney is kidney is okay. Here you can write kidney is normal, but hormone is absent. Okay, so kidney is normal and hormone is absent. That's why this is the central diabetes. But if you see here, nephrogenic diabetes insipidus part, you see that even after giving the synthetic antidiuretic hormone or vasopressin, there is no improvement. Means it is the hormone which was earlier also there and now also don't have any effect. Okay, now you have to remember this part. This is the important one. For the central diabetes insipidus, you have to give desmopressin. Okay, and for the nephrogenic diabetes insipidus, you have to give thiazide. But for lithium induced, you have to give amiloride. Okay, this is important that thiazide is have role in nephrogenic diabetes insipidus. I just giving you 3 4 important things here. Panda. There are 3 things which are important. This is relate to the panda. This is the raccoon eyes. As you see, raccoon eyes is seen in the anterior base of fracture. Okay, anterior side base of fracture. Raccoon eyes. You see, this is the raccoon, also known as panda sign. This is the Gallium 67. You can see in sarcoidosis, and this is the panda sign. Okay, this is seen in Wilson disease. Okay, thank you.